Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today we're going to be talking about sleep disordered breathing for children. Is it important? You bet it is. So stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Welcome to Your Filthy Mouth. I'm Suzanne Lynn, and this is Dr. Chuck.
Hey.
Today, I'm excited about today's episode because just in talking about it ahead of time, there was so much that I didn't know. We're going to be talking about your children and why breathing properly is really important and how many children are not breathing properly.
It's a big deal. It really is. And I'll come right to it and say that they've said that about 50% of the kids that are diagnosed with ADHD have airway issues, have sleep disordered breathing. They're not getting a good night's sleep. Well, you know how you are if you don't get a good night's sleep for one night, 2 nights, 3 nights. Can you imagine going for months without getting a good night's sleep? You're bouncing off the walls.
It's going to affect your behavior and your attitude. And so these poor kids are just not getting a good night's sleep. As a parent, what should we be looking for? How should our children be breathing, and what are some warning signs?
Well, basically, we're supposed to breathe through our nose and eat and drink through the mouth. Okay. And when you breathe through the nose, there's a few things that happen. There's some chemicals that are given away in the nasal passages. They give off nitric acid, which helps with the better absorption of the oxygen. Also, there's more filtering that takes place within there. So we're really supposed to breathe through our nose. And then we eat and drink through the mouth. But if you can't breathe through your nose because you've got congestion, you've got maybe a really narrow palate, you've got huge tonsils that aren't allowing you to get enough air going back there, you're going to do whatever you can do. And that's why a lot of times you see kids that they're grinding their teeth. Why are they grinding their teeth? Sometimes it's to try and get that airway open, to try and get some air going back there.
And they don't even realize it.
No.
You think, well, my kids go to bed at 9 o'clock at night. They get up at 6:30 in the morning. That's a good night's sleep. That's not true.
Well, there's good sleep, and then there's other than good sleep. Mm-hmm. And other than good sleep would be what they call fragmented sleep, where you're going to sleep, but then you're waking up, and then you're going to sleep, then you're waking up, because when your body doesn't have enough oxygen, when the brain doesn't have enough oxygen, your body gets into this, I've got to save myself, fight or flight. And so sometimes you burst out of that just to get a good breath in there. But the kids are going through this all night long. And if you see them laying there with their mouth wide open, breathing through that, and it's really, they're not getting a good night's rest.
Right. So again, breathing in through your nose, out through your nose, and eating with your mouth.
Right.
That's the process it should be. They should not be breathing in through their mouth.
One of the you have to make sure that you don't have any congestion or blocked airways on this.
There are going to be exceptions. Right.
But one of the things, if you don't have that, is they'll actually put some like paper tape over the mouth to close the mouth, to force people to breathe through the nose. And once you get into breathing through the nose, you don't want to kill anybody.
Right. But it's a training to say you should be in and out.
Breathe through your nose.
Right.
Yeah. So
I just keep going back to the fact that, some of our children are on medication for misbehavior or learning disabilities, when you're saying that a good amount of this is that they're not getting a good night's sleep because of how they're breathing. It goes back to the foundation, the basics again that you talk about.
It is basics. Now there's a YouTube video called Finding Connor Deegan, and it talks about this young boy that was labeled as being a problem child because of the way he was acting in school. Well, when he got to be about 11 or 12 years old, someone referred him to an allergist, and they were able to find out he had sinus issues. He had a narrow palate. He wasn't getting a good night's rest. And this poor kid and the family, what they had went through for years before they started looking at the airway issue. And once they got that cleared up, not that he became a model kid, but well, just look at the video. You'll get it.
Yeah.
Finding Connor Deegan.
So what are some of the treatments? If a parent goes, we go to the dentist all the time, every 6 months, we've never thought to ask about breathing, what does a treatment look like, or what can a parent do?
Well, it may or may not have a dental origin to it. It could be with the sinuses. So
Okay.
you may have to see a children's allergist to see what's going on up in the sinuses. It could be they have huge tonsils that are blocking the airway going through there. So maybe tonsils should be removed. They don't remove tonsils like they used to. They used to take them out almost routinely, it
Yeah,
seemed like.
yeah.
But they don't do that as much anymore. But if it's blocking the airway, this is a basic. I mean, we need air is number one, water is number two, food is number three. And if you block number one, you don't even have to worry about two and three.
Right,
Yeah.
right. So again, it goes back to the sleeping. So if you see that your child is not sleeping correctly or breathing correctly, I mean, couldn't they start with a dentist that specializes in sleep disordered?
They're hard to find.
Okay.
Yeah. So you might talk with your pediatrician.
Okay.
You might talk with a children's allergist. You may ask your dentist, how does the airway look from what you can tell. So they can do sleep studies and actually find out, are they getting a good night's sleep?
Wow.
So is it because they may have some type of ADHD. They may need some medication, or they may not. So you want to find out. You want to have the testing done to find out, are they restricted with their airway, or is it something else?
One of the things that you talk about that I think is very interesting is that you're not a dentist factory. You're an oral health physician.
Well, yeah, not a tooth mechanic.
Right.
You're an oral health provider.
Right.
And that's what you want to do is you want to look way beyond just the teeth and the gums. I mean, there's so much more involved because what happens in here affects the heart, affects the brain, affects the pancreas, affects so much of the whole body. This is the front door to the body. And this is where everything is coming in. If your front door is nice and secure, your house is probably going to be a little bit safer.
Right.
If your front door is beat down and a window blowed open, anybody can walk through there. Well, the same thing happens with the bacteria. If your mouth is broken down, you've got a pathway for the bacteria to get right into your bloodstream. If you don't have a good airway in there, you've got a blockage where you're not getting the oxygen your body needs. And if your bite is way off, man, that can give headaches and popping and clicking and all kinds of other issues. So it's not just smiles and chewing and speech. There's a lot more to it.
Awesome. All right. Well, let's get to the question of the week.
Here's Dr. Chuck's question of the week.
And our question of the week comes from JP. He wrote into Your Filthy Mouth, and he's asking about enamel. And if it renews, is it like bone? What do you say?
No, bone is different. Bone, you lay down calcium or you take up calcium. You've got your thyroid that helps to regulate parathyroid that helps to regulate your calcium levels in your bloodstream. So the bone is a different thing. Teeth. Once the tooth is formed, that's pretty much it. Once that enamel is formed, that's it. I mean, sharks, they keep getting new teeth, so it doesn't matter if they get a cavity in there.
Oh, that's kind of cool.
Okay? But us, this is it. Once it comes in, that's generally it. So there are some remedies out there for remineralizing the teeth, where you got white spots. You can put this on and remineralize. In my mind, the jury is still out on what's happening on that.
Okay.
But the best thing is prevention. Just keep the teeth really clean. The hardest thing is when kids have braces on, because it becomes more challenging to keep those clean. Invisalign is great, or ClearCorrect is great, because you can take them out, you can clean your teeth real good, and you pop them back in. But when you've got the metal brackets, you have a plaque trap. And so this is where you need water irrigation. You need to take your time and really clean that. Because I'd much rather see crooked, strong teeth than straight teeth with a bunch of ugly white blotches all over them because you didn't keep them clean. So when you see somebody with a lot of white blotches, many times they had orthodontics, they had braces, and just didn't keep the teeth clean.
Very good. All right. Good question, JP. Thank you for writing in. And also, you can write in with the question of the week. We're going to send you, I hear that we've got some mugs
They're on the way.
that are ordered. They're going to be, pretty cool. Okay, so today's show, we're talking about children and breathing. And so the three takeaways, starting with, if your child's acting up, it could be a breathing disorder that's keeping them from getting a good night's sleep.
Just don't jump to the conclusion that, they have ADHD. Let's figure out some things first. Do a little bit of testing first. Make sure they can breathe okay. That seems like an obvious thing, but it's amazing how many times it's overlooked.
Wow. The second thing is get it treated.
Absolutely. Yeah, just because you discovered it, now you have to do something about it. And that treatment may take several different types of doctors. You might need an allergist. You might need a dentist. You might need an orthodontist. You might need possibly a surgeon for tonsils. I mean, there are different things you need, but find out what's going on and get it treated.
And if you're finding, you had said that the breathing should be in and out of the nose and eating is the mouth. If you find that a child's breathing through the mouth, that could be a sign, right?
Absolutely. If you got a youngster and you see them breathing with their mouth open when they're sleeping, why? Let's go into why. Ideally, you're going to breathe through your nose, and that's what we want to try and encourage people to do. As our diets are changing over the decades, a lot of our food is not as it's already processed. It doesn't take as much effort. So people aren't chewing as hard, which is not developing.
Is that good or bad?
That's bad.
Okay.
Because we want to, it's easier to swallow, but we're not developing the muscles, we're not developing the bones like when you had to chew a little bit harder. So, it's easier, but maybe we're not developing the way we ideally should.
Right. I remember my mom always threatening me, if you don't brush your teeth right, all you're going to be able to eat when you're older is soup. I'm like, okay, I guess whatever inspires you,
Yeah.
So takeaway number 3 is to continue to evaluate over time.
Absolutely. Yeah, you want to make sure that our bodies change with time. And included in that is the jaw, is the sinuses, is the airway. So how is that changing? If it's getting a little bigger and you're able to breathe a little better, wonderful. Now that may take some assistance from an orthodontist or from some other healthcare providers, but you want to continue to evaluate that. So just because it was working good 3 years ago, it doesn't mean it's going to be working good today.
So in essence, a child might outgrow it.
Absolutely.
Right.
Absolutely.
Okay.
That's possible.
Okay.
So, again, just continue to monitor it. I mean, you're watching your kids for their grades in school. Well, let's watch our kids for their grades with sleeping.
Yeah.
Yeah.
Really good, important show. Thank you for watching Your Filthy Mouth. Would you please share this information? I mean, you can start by subscribing and sharing with your family and friends about how important good oral hygiene is.
Well, what we're trying to do is get the word out about just how important oral health is for the rest of the body. There's this deadly gap between physicians and dentists, and if you remember back in the 90s, the military had don't ask, don't tell.
Yeah.
Well, we have it in the medical field right now. Physicians don't ask and dentists don't tell.
Wow.
And we've got these things that are going on inside the mouth, whether they be infections going on, whether they be airway restrictions, or whether they bite, that dentists are identifying, but we're not telling the physician. Physicians aren't asking, gee, is there an oral infection that be causing this bacteremia that's going on? Like, where did the bacteria come from that attacked the heart valve? Well,
so they're treating the symptom, right?
Let's get to the source. A lot of times the source is literally right under your nose.
I like that.
Yeah.
All right. Well, thanks for watching this edition of Your Filthy Mouth.
Thank you.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.